North America and South America already. This one, we put the patent on the whole world. So any of them, they have to buy our patent to use the A-type camera. Can you see the cutting hook here? This is the cut portion that I mentioned to you. So this area will melt more fast. So usually 4 months average. If you use only the cork thread for lifting, 4 months, sudden drop down. Okay, so these are some of the new cannulas and new thread starting to use by some advanced doctors in Korea and other countries. Okay. So I always tell you, whenever there is a new thing, if you are doing the thread, you have to promote to your patient. So the patient will trust you. Oh, I don't have to go to other clinics. If I come to your clinic, always there is something new. That's how I take care of my patient. Okay? This Octatrace is really one of the best threads. I just review one more time for the techniques. As I mentioned to you, there are 2 types of thread lifting. One is collagen stimulation technique, and one is mechanical lifting technique. But if you are a beginner, I advise you to do collagen stimulation technique first. Even myself, I did 3 years for collagen stimulation technique. Okay? But still the result is much better than any other machine you have in your clinic. Any lifting machine. Thermage or Thera or Double O, Ultraformer, whatever. You can compare half phase with those famous machine. You can compare half phase with this even mono, tornado. You will see the effect is totally different. Machine is machine. You should understand this, okay? And I always mention to you, if you are going to practice the aesthetic for a long time, don't depend on the machine. Machine will not save you. Machine will not help you. It helps you only short time. Why? For example, doctor, how long have you been practicing aesthetics? Huh? How many years? 5 years. Okay, let's say there's a newcomer, new doctor, newly graduate. And then there is a new machine. Let's say some machine called Action Prime. New machine. You buy today. This new doctor buy tomorrow. You buy almost at the same time. Then your skill using the Action Prime almost same. But you've been doing thread for 5 years. And this new doctor starts today. Do you think you done 5 years of thread? This new doctor just started. Do you think the skill is same? Totally different. So that I tell you, thread, the more you do, your skill will be more there. So it will save you from your competitors. Do you understand? The machine you buy, nowadays, before, 10 years ago, the first machine I buy was the quantum IPL and Enlight, and also fractional laser, Fraxel from and also fractional, the upgrade one from year 2006. I bought it $200,000 in Korea. Yes, but after 3 years, so many Fraxel came out. CO2 Fraxel, Orbium Fraxel, NDF Fraxel came out. And I want to, of course, I made some good profit, but the handpiece was so expensive. So I pay the lease, I pay the handpiece, and after 3 years, I want to sell the machine. You know how much I sold the machine after 4 years? $20,000. Nobody wants to buy the old Fraxel. They want to buy the new Fraxel. So that means you pay a lot of lease. Of course you treat, but still you pay a lot of handpiece consumables. I found nothing left for profit. So, but the threat is relatively cheap. It's like this. Of course, there are many competitors, but if your skill is going up there, you can charge very expensive. I'm still many Korean doctors now in Korea because so many competitors. They charge very cheap, but I charge very expensive. Still, I have a patient lining up. Tomorrow I go back, I have more than 12 patients for the threat. So you have to understand, there are some machines, of course, you must have in your clinic, like a CO2 laser. I use it already more than 15 years, still there. My air dissector, I use it more than 10 years. Year 2009, now 10 years. Yeah, Dr. Wang, you saw my air dissector about 10 years ago in my clinic, right? Yeah, he has been to my clinic long time ago. The machine stayed there. My RF cannula, I used it since year 2010-11, already 8 to 9 years. So some of you have been to my clinic, you saw the machine 8 years, but still I'm using it. So you have to understand, find out which machine can stay very long in your clinic, which machine after the fashion, throw it away and sell. So you have to distinguish very well. And those machines which will stay with you long, you build up your skills, then no one can catch you. That's how I always train doctors continuously, so you will have the more patient and more profit to your clinic with the less spend to the very expensive machine. Okay, so this collagen stimulation seems very easy. One thing that I really feel pity nowadays, you go to the big conference in Korea and some other country, they always talk about the cork molding, the long, thick ones, right? Have you seen some other convention or conference, they emphasize about the collagen stimulation techniques? Maybe you not find much. You know why? I found out there are only few doctors who mastered the collagen stimulation technique yet. You know, when I say master, okay, I give you a sample, master. For example, if you have been to also my other lectures, I always say the high-end doctor not only doing the lifting, but you can control the face. Okay, so not only the lifting, that is a very middle-class doctor, but you can shape the face is the high-end class doctor with collagen stimulation thread. That's why I sometimes show you, you have the double chin, I can put it back in 5 minutes, right? I showed you before, right? Sometimes I use only mono, but this nasal labial fold, we don't put the filler here, but I can bring this one, I can bring down. So it seems like the nasal labial fold improve. Okay, so we can, this malar protrusion, Korean, Asian, many bony protrusion here. Can you imagine? You can put down this one with my RF cannula and 5 tornado thread without cutting the bone, without trimming down the bone. I proved it many times in the live demonstration. So if you master the collagen stimulation thread, you can shape the face, okay? Also, we can shape the eyes, So this is the lateral one. So lateral one, especially when most of the patient, drooping like this, right? So when they want to lift up here, then you can put the lateral one. This one doesn't have a hope. How do you think this will give the lifting? Usually when you put the optometry here, the patient will tell you, oh, I feel like somebody pulling my eye. You see? But it's not a cork which put like this. But they feel the natural fullness, and then something is, they feel like something is pulling their eye. It's very natural, but very effective. And also this one under the neck. Do you remember last time when I gave you the lecture, I told you do not use the cork thread under the neck area. Remember? Why? What happened usually? The problem? You use the cork thread under the neck. Anybody encounter any problem? If you use the cork thread, especially the cutting cork under the neck, after I told you the full thread 6 to 8 months or so, but the cutting cork one about average 4 months, 3 to 4 months, there will be the weak point will break, and they will be wandering around. You see the sudden protrusion of the thread, especially the skin is thin here. So many cases you will encounter this problem if you use the cork. But the emboss and super emboss will not encounter that kind of problem. So you can use the cannula emboss mode or super emboss mode under the neck area safely. Okay, so here something like this. Usually 3. Okay, we don't go more than 3. 3 for each region. Okay. Today we have so many actually things to show, but too much for one session. Anyway, I will show you here something first. Can you see this deep wrinkle? Can you solve this one with the Botox? Can you solve this one with the HA filler, no matter how hard is the filler? It's impossible. He's more than 70, I think 75 years old, 73 years old, something like that. But if you solve this one with your technique, also very simple, then you will have a lot of patience. Can you see also the wrinkle here? It's 3 wrinkles. Most people have 2. But some people have 3, so we also call it Maserati wrinkle. You see the Maserati? The 3 spots? If you remember, I was the first one in Korea, first one in the world use the avatar nose. You know, the one put the filler and become broad. I was the first one use this term. Okay. And also, I was the first one to use the V-lifting, V-line in Korea, and at the same time in the world. So we also have many new terms for selecting. Okay, this is a little cane with the epinephrine. I will just go quickly because we have not much time. So just follow the lines and make a puncture. This is an RF cannula. You know, I always show you the RF cannula. Last time I showed here the RF cannula for the iMac. Can you feel? It's very stiff. Even though it's with RF cannula, you don't think you will do with ordinary cannula. You cannot do with the ordinary cannula. It's very stiff. Even though RF is very difficult to push it. It's a very stiff, I tell you. So you break all the adhesions by the RF cannula. I tell you, if you remove these wrinkles, you will have a lot of patience after seeing his face. Everybody will tell you, wow, where's your wrinkles? You become so much younger.